We want to begin with a pandemic and some large and disturbing numbers in LA County today.
That's right, 102 new deaths, the most in a single day since March of last year.
Case numbers jumped back up to more than 42,000. That's not far from last week's record high of 45,000.
Hospitalizations also continue to climb, topping 4,800. The good news, those numbers may soon plateau.
The bad news, a USC study shows we may never achieve herd immunity. KCAL9 Sarah Donchi, she's live in Glendale with more.
Well, there is a little bit to unpack here, Jasmine and Tom, in terms of the mixed news, as you mentioned. So this part of the pandemic has been especially hard for healthcare workers, and a lot of those struggles have happened behind closed doors. For the rest of us, life has continued in many ways, but for them, they are overworked, understaffed, and they are facing an influx of patients for different reasons. But as you mentioned, there are some signs to be, for people to be optimistic. Perhaps cautious optimism is a good way to put it. An explosion of COVID-19 cases has placed SoCal in the biggest surge of the entire pandemic. But LA County health leaders say they are starting to see small dips in cases and test positivity. So have we reached the peak of the Omicron surge? Dr. Barbara Ferrer says not so fast.
I'd love to see signs that we're in a real decline. But I think we have to wait to get a complete week's worth of data here.
LA County reported 102 more COVID-19 deaths Thursday, the highest number since March of 2021. And hospitalizations are the highest they've been since the last winter surge. The numbers disproportionately high for Black and Latino residents. About half of COVID-positive hospital patients are there for issues related to the virus, the other half for other reasons. In any case, doctors say the strain on staff and resources remains the same.
Wait times to be seen in the emergency department are higher than ever before.
Some hospitals have reported hours-long waits for beds and a shortage of staff.
We oftentimes will have a line of 2, 3, 4 paramedic gurneys waiting to offload their patients simply because we don't have a bed in the emergency department.
So what could the future look like? A new study from USC says we will probably never achieve herd immunity in LA County. And some researchers say it is time to focus on living with COVID.
So I think it is very likely that we will continue to have these COVID surges, and we need to now start focusing our attention on how can we minimize the harm from these surges. And one way to do that might be to expand access to the new treatments.
LA County health leaders say that while antiviral treatments like Pfizer's COVID-19 pill could be the key to getting back to normal, supplies are still too limited and access is an issue. And LA health leaders are warning people to take Omicron seriously. Dr. Ferrer believes 90% of people who died Thursday were likely infected with Omicron.
While Omicron is not causing the same proportion of severe illness as last winter, and you can see that on all of our slides, it is substantially increasing cases of severe illness. And for a growing number of LA County individuals, Omicron has now become a critical matter of life and death.
So now I talked to a couple of different ER doctors to get their takes on what is going on at their hospitals. And they basically said while things are still very difficult right now, that for the first time in a long time, things aren't getting worse by the day. And so they say that is a good sign, and they hope that that means that things are plateauing. But as you heard in the report, Dr. Ferrer and other epidemiologists say we just need a bigger picture of data before they can make that official assessment. Reporting live in Glendale, I'm Sarah Donchi, KCAL9 News.